Hi, my name is Diego Espinoza. According to Monaghan, the editor at large of Healthcare IT News, who covers hospitals and industry trends, stated that an estimated 80% of serious medical errors involve miscommunication between caregivers. Morgan states that errors begin during handoff of patient care, involving nurse to nurse or physician to nurse. Nurse to nurse could be from shift change, or just, sometimes you get sent home, your census is low, and you have to pass off a report to another nurse. And a lot of times you're just trying to get out of there, so you might not give a good, thorough report, and that's where the communication breakdown happens. And with physicians, time management, everybody's real busy, and you don't give accurate reports. Marshall Allen, a reporter for ProPublica, a journalism website for public interest, stated that medical errors could be the third leading cause of death in the United States. That would be behind heart disease and cancer. In his article, Marshall stated that communication was among one of the categories of preventable adverse events, or a sentinel event, as some people know it as. But it's just something that happened that caused injury or affected the patient's care. As a floor nurse on the med-surg unit at Gordon Hospital, I see firsthand the risk of error with poor communication and the potential for improvement. Nurses are known as communicators. When we went through school, we learned that communication was going to be a big role in our day-to-day activities. Communication is a vital element in nursing in all areas of activity and in all its interventions, such as prevention, treatment, therapy, rehabilitation, education, and health promotion. We will focus today on different communication barriers in healthcare. I will be going over physician to nurse. Nancy Sharp will be going over patient disabilities. Samantha Gagliano will be going over cultural barriers. Brandy Johnson will be going over language barriers. Kriya Bielself will be going over education barriers. And Morris Holly will be going over overcoming barriers with an empathetic skill set. So with all these different kinds of barriers, the nurse must mold her communication skills to fit the different kinds of barriers. So first, let's review the barriers caused by nurse and physician communication. Here I will insert a video that's about 2 minutes long. There are evidence barriers between nurses and physicians. Evident barriers. Education between physicians and nurses is one of the big things. Doctors go to school for several years compared to a nurse. And throughout that whole time in school, doctors really don't go into bedside manner, whereas nurses do. In the short time that we're there, it's part of our curriculum, bedside manner, how to be empathetic to the patient. So that's a big one. Also, time, as I mentioned before, is a big factor in poor communication. Doctors want the essential information. You have to give it to them because they're busy and we're busy. So you have to find the time to talk to the doctor, give him the information he needs, get his response, and act accordingly. In his publication, Shara Taran, a graduate of McGill University, details the types of communication errors between nurses and physicians. A few. Some are written communication, where a physician puts in an order, doesn't tell us that he put in the order, and a nurse takes a long time to review the orders because she's got other things to do. I'm sure this has happened, and by the time you go and look at the orders, you're 2 hours late giving a medicine. Also verbal communications, if you have to call the doctor in the middle of the night, he's sleeping, he gives you an order, he's not quite clear, you don't want to ask him to repeat himself because he's already mad that you called him. You know, and then you just hang up the phone and you realize, oh, you're missing this key information that you need. You know, and you know, that could be a problem. And also delayed communication. Tehran states that, you know, when you don't feel comfortable talking to the physicians and you wait and put off something that is critical to the patient's care, you know, that also is an issue. So developing a standard of communication between physicians and nurses can reduce errors in communication. Some of those ways to correct these are time management. You know, we learned that, and that's going to be a big key, is time management and prioritization. Find what's more important at that time, get it done. You know, sometimes you can bundle up. Some doctors like you to bundle up. You've got several questions for, if you've got something that a patient asks you for, but it's not urgent, don't call the doctor at that time. And maybe later on you'll have something else, and then you can call them about the two things. Also, using SBAR, which is a tool that nurses use to give handoff reports to the oncoming nurses, which is situation, background assessment, and recommendation. You can always change these. It's you know, common practice to use these when you're giving off a report, but you can adjust this to yourself so that you can start using this and have a standard of communication with the physician. And say, when I call the physician, I'm going to have this information for them. So just, these are a couple of things that you could do to try to help communication between physicians and nurses. So now, we will talk about, Nancy's going to talk about patient disabilities, barriers.